Hello friends, I am Dr. Deepak Garg. I am an orthopedic surgeon and today we will discuss about how to evaluate a failed primary total hip replacement. So what are the common indications for a revision total knee arthroplasty? So instability and aseptic loosening are the most common, then infection and sometimes the component failure or sometimes the fractures. So these are the main indications for a revision hip replacement surgery. Now the core principle of the evaluation is when the patient is having a pain after a total hip replacement surgery, then we should use a algorithmic approach considering the intrinsic and the extrinsic factors separately. So all the intrinsic factors like the arising from within the hip joint, like the infection or instability, aseptic loosening, component failure, bone fractures, or some muscular soft tissue problems like iliopsoas tendinitis or trochanteric bursitis. So these are the intrinsic factor. Extrinsic means everything outside the hip joint. That can be a pain from the spine, that can be a pain from the hernia or some other neurological or gynecological or urological causes. So that is extrinsic factors. We should also know about the extrinsic things that can cause or mimic a pain in the hip region. So let's start with the stepwise algorithm. So we will first start with the history and the physical examination. So let's look at the pain pattern and the likely diagnosis that the patient can have. If the patient is having a persistent pain after the surgery, that is likely suggestive of either infection or like the hip poor indication of the hip surgery. That means the reason of the pain was from somewhere else and the hip replacement surgery was done, that the pain is still persisting. Then if the pain-free interval is there, pain starts late, then it can also indicate about the loosening of the component, wear or some infection, late infections. Then if the patient is having a groin pain, that is mostly suggestive of either acetabular pathology or iliopsoas muscle irritation. Thigh pain is suggestive of a femoral component, either loosening or something in the femur. Trochanteric pain is suggestive of the either GT fracture or some trochanteric bursitis. Night pain is suggestive of infection or some abnormality or pathology in the bone, that can be a malignancy also. Burning pain is usually suggestive of a nerve etiology. Then the physical examination finding and their interpretation. If the patient is having a Trendelenburg gait, then most probably he is having an abductor deficiency. Pain with passive motion is suggestive of infection. Pain with active motion is suggestive of some soft tissue problem. Limb length discrepancy, which is increasing with time, suggestive of a mechanical failure. And if the patient is having signs of inflammation, that can be suggestive of infection. Now let's get the radiology like x-rays and let's interpret the radiology. If there is a radiolucent line around the component and that is progressing, so we will have to compare it to two separate time x-rays, then it is suggestive of loosening. If there is a rapid osteolysis, then that may be because of some abnormal pathology around the component, that can be because of infection. If there is a component migration, again it is suggestive of loosening. Polyethylene wear will be a very late failure. Fracture lines suggestive of a periprosthetic fracture. So this is how we interpret the radiology. Then how we suspect the infection. If there are signs of inflammation, if there is a sinus tract, then that is diagnostic of infection. There is no doubt or question mark. ESR CRP elevated are indicators of infection. Early osteolysis, again suggestive of infection. Then mechanical causes of failure in total hip arthroplasty. It can be instability due to which may lead to dislocation, aseptic loosening of any component. Then in the radiology we will be seeing migration of the component or patient will have a pain on the weight bearing. Polyethylene wear, fracture, periprosthetic fracture or osteolysis. These are all suggestive of mechanical failure of a total hip replacement. Then the other thing can be a soft tissue problem. It can be a trochanteric bursitis, iliopsoas tendinitis or abductor deficiency. So this is how we evaluate a painful total hip replacement. So painful total hip replacement can be, first we should know whether this is intrinsic or extrinsic. If it is intrinsic, then we should know the most common causes are instability, component loosening, there is a problem in the bone, there is a problem in the component. So if there is a, then we should look at the patterns of the pain. We should have a physical examination, proper physical examination and proper radiology. Accordingly, we should reach at a diagnosis whether this is a problem of the there is a loosening, there is an infection, there is a fracture, there is a, or this is a soft tissue problem. And this is how algorithmically we should approach the patient. So this was about today's video. Thank you guys. Thank you very much for watching this video.